today's World Insight, Wuhan's count of COVID-19 cases and deaths raised. What the new data mean for global efforts against the pandemic. A rise in geopolitical tensions despite the need for cooperation. Why?
For COVID-19, we should also ask American and Chinese scientists to work together.
And there's nothing like the universal language of music to bring together people from around the world. One renowned Chinese concert pianist is doing his part in this effort.
I think as a human being, we need music, we need great, kind of emotion being together.
Here is our host, Tian Wei.
Hello and welcome to World Insight, coming to you from Beijing. I'm Tian Wei. We start today's show with the latest in China on the COVID-19 pandemic. The city of Wuhan, which used to be the epicenter of the outbreak in China, has revised its number of confirmed cases and death toll today. Over 300 cases have been added to the total infections, and over 1,200 more coronavirus-related deaths have been confirmed. Take a look at the updated numbers.
Wuhan has raised its COVID-19 tally. The pandemic killed more people than earlier known. Authorities report 325 more confirmed infections, which brings the overall number to 50,333. There are an additional 1,290 deaths. That puts the fatality tally in the city at 3,869. The rise of the death toll has drawn wide discussions. When asked about the reason for the revision, Wuhan authorities said due to limited hospital capacity and the shortage of medical staff, some patients were not treated at hospital. Also, a few medical institutions failed to get in touch with local disease control and prevention systems in a timely manner, which resulted in the delayed reporting of confirmed cases and failures to count patients accurately. Worldwide, confirmed COVID-19 cases have surpassed 2 million. The WHO rang the alarm bells with some European countries who are preparing to ease their pandemic restrictions.
And now we are joined by Liu Yuanli, the Dean of the School of Public Health for Peking Union Medical College. Professor Liu, welcome to our program.
Glad to be on your program.
Immediate response from you about the adjustment of numbers in terms of confirmed cases and deaths regarding Wuhan today.
This is not the first time the numbers coming out of Wuhan got updated and adjusted. I remember back in February, I think it's February 12th, the number of confirmed cases got updated by quite a magnitude because of the changing of the diagnostic criteria. So this time, I think, of course, I found it not surprising, but what's remarkable of the new update is that the death toll is increased by almost a third.
Yes.
That, of course, is due to several reasons, largely legitimate, because, as we know, Wuhan is the first epicenter of this pandemic. It's also the knowledge center. We are literally learning about our enemy while fighting the war. So the statistics, especially the underlying causes of death, will take some time and take efforts to get a firm handle on this. But, as an old saying suggests, it's better to be late than sorry. I think now updating this very relevant and important information is expression of China's responsible and scientific attitude towards developing a comprehensive understanding of this new disease.
Professor Liu, about the death rate. Now, we see, as you just suggested, the increase of 1/3. That's quite a huge number. What does that mean in terms of people's knowledge about different cases of death during that period of time of the outbreak in Wuhan, now in retrospect?
We know very early on that this new disease is very infectious. The basic reproductive number or index. That is to say, without any intervention, one person would affect how many other persons. So the latest estimate of the basic reproduction index is between 2 and 3. So by that number, would only take 21 days for the 8 billion people on this planet to be all infected. But how fatal, how vicious this disease, I think the scientific understanding of that question is still evolving. Therefore, the latest statistic coming out of Wuhan is very important. And this update is translated into the increase of the original estimate of case fatality rate from 5.1% to 7.6%. So an increase by 2.5 percentage points. So that has very important implications for the global anti-pandemic policies. You see, that basically means for those countries who have been contemplating about adapting a more passive approach to the war against COVID-19, namely mitigation and give the population a chance to develop a herd immunity. And if you adopt that policy, and the human costs will be enormous. Because now we know from the latest statistic that this disease is not only infectious, but very, very much more vicious than we previously thought.
Professor Liu, the latest I checked, the city of New York, which is the epicenter for the United States, has today more than 450 deaths per day. Now, this gives us a lot of thought about when it comes to the spreading of the virus and the development stages of the virus, as well as the measures of prevention, control, mitigation being taken, the timing of it, and the strictness of it. How much will all of these factors have an impact on the eventual number of deaths?
As the founder of medical economics, Ken Arrow, who is a Nobel economic laureate, pointed out, medicine is about decision-making under uncertainty. There are a lot of uncertainties about the diseases, and we practice medicine according to the latest evidence, and the evidence is evolving, is dynamic, so our practice will be adjusted accordingly. That's why among the 4 principles highlighted by President Xi Jinping, determination, solidarity, science, and precision. And among the 4 principles, science-based approach and the precision medicine is really called for. Now, that's a very lofty goal, but we are learning as we are doing it. And early on, China classified confirmed cases into 4 categories: mild, ordinary, severe, and critical. So China developed a differentiated treatment protocol and guidelines depending on what category, what stages a patient is at. Particularly, China has learned a lot of useful lessons about early intervention, about combining the Western and traditional Chinese medicine to boost up the immune system at early stage, and trying to block the overreaction of a human body's immune responses at a later stage. So all those important clinical information experiences are now being shared by the Chinese clinicians with their international counterparts.
How should we understand information and facts as far as you could gather vis-a-vis information and facts in retrospect, Professor?
In the field of science, we make careful distinction between data, information, and the knowledge. Okay, so what we are aiming at is generating meaningful and actionable knowledge based on data, facts, and organized information. And as the availability of data improves, of course, our analysis and our judgment, our conclusion, and our body of knowledge will be expanded accordingly. So transparency is very important in this business. Transparency assumes that we know everything we need to know. But in the real world, that's not. So we should tell the world what we know for certain, but we also should tell the world what we don't know and we like to know. And we will keep the scientific community, our clinicians, and the public at large posted as our information becomes more available. So that's the honest, frank, and scientific approach for communication and sharing of information.
Professor Liu, we've seen the adjustment of numbers, or rather the updates of numbers, both of confirmed cases, suspected cases, as well as death rates being done in several countries and in several epicenters. Are we expecting these numbers to change for the near future? Because that would, in a way, help us to get a better understanding of exactly what is the nature, or rather to nail down the nature of this virus.
I think it's only rational to expect those numbers to be adjusted and changed over time as more information become available. And you see, the latest example is in New York. The Governor Cuomo estimated initially that there is overwhelming of the healthcare system and so on and so forth. But as it turned out, the healthcare facilities were underutilized, the ICUs and the emergency rooms and so on and so forth. So that's a good news. But sometimes we can also underestimate the seriousness of the pandemic. So because, like I suggested, medicine to begin with is a science and art under uncertainty.
Right.
And it is especially true with regard to a novel virus and a new disease such as COVID-19.
Thank you so much, Professor Liu Yuanli, the Dean of the School of Public Health from Peking Union Medical College. You're watching World Insight. Still to come on our program. Along with the global coronavirus spread is a rise of geopolitical tensions and nationalism despite the need for cooperation. How do we make sense of all of these? And what's the answer to the crisis? From a former Singaporean diplomat right after this. Welcome back. You're watching World Insight. I'm Tian Wei. As the world grapples with a plague of coronavirus infections, experts call for global solidarity and cooperation against the pandemic. They believe though tensions are rising, the U.S. and China must work together to turn the tide against the virus. Earlier, I had a chance to talk with Mr. Kishore Mahbubani, former Dean of the Lee Kuan Yew School of Public Policy with National University of Singapore. He shares his views on geopolitics and the pandemic. I'm joined by Kishore Mahbubani, Distinguished Fellow from the Asia Research Institute of National University of Singapore. Professor Mahbubani, what a pleasure seeing you.
My pleasure to be with you too.
Since the virus had become public enemy number one, or should have become public enemy number one, and yet now we see it's not just one government against another government, one country against another country, but rather, attacks on international institutions such as WHO, which is the leading organization against COVID-19. What do you make of that?
Well, I mean, I find the attacks on WHO very sad, tragic, and unfair. Because, you know, I was Singapore's ambassador to the UN for over 10 years. And what I find very sad is that the Western countries, the same Western countries who in a sense gifted the 1945 rules-based order to the world and created the UN family of organizations, these same Western countries have been undermining and weakening multilateral organizations, including the World Health Organization, WHO. And if you want one statistic that describes this very well, in 1971, 62% of the budget of the WHO came from mandatory compulsory contributions and 38% came from voluntary contributions. But by 2017, the compulsory contributions went down from 62% to 18%. And that's a terrible thing to do because the WHO cannot recruit long-term scientific expertise, cannot recruit health inspectors, cannot recruit long-term staff to manage all these things on the basis of voluntary contributions, which make up 82% of the budget. So something has gone drastically wrong in the way the world has handled WHO and the way that the West has tried to weaken the WHO. So I hope if there's one lesson we should take away from COVID-19, the one big lesson, and I use a very simple boat analogy in my book, The Great Convergence. In the past, when 7.5 billion people live in 193 separate countries, it was as though they were living in separate boats, right? So each boat had a captain, a crew of his own. But when the world has shrunk and become so small, so interconnected, so interdependent, today the 7.5 billion people of planet Earth live in 193 separate cabins on one boat. So if all of us are on the same boat, it doesn't matter whether you keep your cabin clean because you have to take care of the boat because the viruses are going to come from the rest of the boat. You're still on the boat. So you have to work to take care of the boat as a whole, and that's why the World Health Organization was set up, to take care of all countries in the world. So instead of attacking the World Health Organization today, we should all be coming together and say, why have we not strengthened the World Health Organization? So I hope COVID-19 will lead to more resources being given to the World Health Organization.
And of course, the U.S. Now tries to suspend their funding for WHO, at least partially. Well, at the same time, some of the developing countries and emerging economies, China included, is trying to support WHO. China earlier donated 20 million to WHO. However, as a result of that, being accused of trying to buy up WHO, and WHO had become China-centered. Your thoughts?
Well, I think we should be very rational in our responses to these attacks on WHO. And I think the best thing that WHO can do is to not bring together the politicians, because politicians have political agendas. WHO should bring together the medical communities around the world. The medical communities in the world understand that 7.5 billion people belong to one species.
That's right.
You know, when the virus crosses borders, the virus doesn't say, are you Chinese? Are you Indian? Are you American? Are you European? They don't care. The virus will attack you because you are human. So all of us, the human species, must come together as one species and fight this virus. So let's forget our nationality and let's stop attacking each other politically. And the best way to do that is to bring together the doctors. So as you know, in the previous crisis, when we had Ebola, when we had SARS, American and Chinese scientists were working together. So this time around, for COVID-19, we should also ask American and Chinese scientists to work together, because the virus is attacking everybody, not one country.
but I'm not sure whether it is right now for some. For example, Professor Mahbubani, you argue in your book, Has China Won? Of course, by the way, that's a curious title you have over there. You're not trying to answer that question directly, but rather to pose a question over there. Professor Mahbubani, you argue about some of the Cold War mentality coming back in some people's mind. Tell me more about what you're thinking. What do you mean? And where is China, where is the United States now in that set of format you have just posed in your book?
Well, the reason why a lot of this Cold War reflexes are coming back is because, you know, I begin my book, Tianwei, by describing a one-on-one lunch I had with Henry Kissinger in his private club in March 2018, 2 years ago. And at the end of the lunch, the impression I got from Dr. Henry Kissinger was that the United States had made a mistake in launching a geopolitical contest against China without first working out a comprehensive long-term strategy on how to handle the geopolitical contest. And because of that, things are being done very impulsively, irrationally, and often with no strategy. And in many ways, I also begin the book by quoting from another man, another great American strategic thinker, George Kennan, who gave the United States very valuable advice. He said, before you start a geopolitical contest against the Soviet Union, the former Cold War, he says, first, you must focus on your domestic strength. That's the most important thing. Number two, you must build up friends and allies. And number three, you mustn't insult your enemies. And number four, you must be humble. Now, these are 4 pieces of advice that George Kennan gave in 1949, and the United States today, sadly, is not following any of these 4 pieces of advice. For example, in terms of its national condition, the United States, which used to be the most successful country on planet Earth, has become the only major developed country where the average income of the bottom 50% has gone down over a 30-year period. Now, George Kennan would disapprove and say, hey, first we have to fix our country before we go and getting engaged in geopolitical contests. And he would also say, why don't you talk to our friends and allies around the world and see what they're saying? And if the United States actually took an effort to listen to other countries, most other countries are advising the United States, please don't get involved in this geopolitical contest. Let us focus on our common needs and challenges. And certainly today, let us focus on COVID-19 and not get caught in another geopolitical contest. So all the very wise advice given by Henry Kissinger, given by George Kennan, is not being listened to today.
Professor Mahbubani, while we are talking about China-U.S. relations, we also have several things going on. For example, at the public health level, you cover the COVID-19, which we do not know when is the end of this pandemic and whether it's going to come with different waves of impact. And on the other hand, we still do not know its economic and social impact. Some could even argue comparable to the 1920s recession. So we seem to have several layers of things intertwined with one another, making things ever more complicated, Professor.
Yes, you're absolutely right, Tianwei, that this COVID-19 has been far more devastating in its impact than anybody imagined. And it is possible that we can get a major recession or maybe a depression like the 1930s, as you mentioned. Why did the 1930s depression happen? Because of the smooth, holly tariffs. So if you raise tariffs, if you have become protectionist, the economy suffers. So, for example, I'm advocating in one of my articles that if the United States wants to see a quick rebound of its economy after COVID-19, it should announce today now that it is going to remove all tariffs on all recently imposed tariffs on goods from China, Europe, Mexico, everyone. Just remove the tariffs. Now, there will not be an immediate impact on the markets. But the markets will say, wow, when things get back to normal, these tariffs will be gone. The trade will will improve. So there are things we can do. We can learn lessons from past mistakes and start doing the right things. And this is precise. So clearly, if you want markets to jump up, all you have to do is announce that the United States and China are from today going to work together against COVID-19 and are going to work together to rebuild the global economy immediately after COVID-19. And I believe me, if you can make the announcement, the markets will go up dramatically.
Professor, tell us about your thought on the latest pandemic, COVID-19, and its impact, it seems, on the geopolitical discussion we've been having.
Well, I think COVID-19, as you know, a massive challenge to our world. And the logical thing for humanity to do is to focus on these major challenges from COVID-19 and set aside all other differences for now in this life and death battle against this virus. But sadly, the world hasn't done that. And sadly also, the United States has continued its geopolitical contest with China in the middle of this COVID-19 crisis. And I have tried to argue in my book, Has China Won?, that frankly, there are no fundamental differences of interest between US and China. And certainly when it comes to COVID-19, the US and China should be cooperating with each other for the benefit of the world rather than continuing the contest at this dangerous time.
But Professor Mahbubani, of course, internal politics always has become the priority for many politicians, and therefore not necessarily handling the crisis well back at home has to have its own excuses. Now we see geopolitics has been used as a tool for that, isn't it?
Internal politics, especially in democratic societies, is also about winning the trust and confidence of your own population. And if your own population feels very endangered and threatened by this virus, it becomes very dangerous to play political games with it. You may get some short-term political victories by playing games with it, but at the end of the day, the people can be very well informed, and they can tell when a leader is doing well and improving the situation, like, for example, the Prime Minister of New Zealand, who's very, very focused on COVID-19. Whereas in the United States, sadly, the politicians are trying to make political capital out of it. And as a result of it, again, very sadly, the number of deaths and the number of cases in the United States is now incredibly large. And it shows that there hasn't been insufficient attention being paid to fighting COVID-19 first.
One after another accusation after China and some of the other Asian countries like South Korea, like Singapore, where you are, have been able to climb on their own out of the crisis as a result of COVID-19. What does that say about people's ability to recognize what should be learned and what should be the strategies forward? But now we see more accusations and rather comparison of notes.
Singapore, as you know, is in day 8 or day 9 of its lockdown, and we are still fighting it in Singapore. So I'm doing this interview at home because we are in a lockdown. But at the same time, it's also clear, I mean, if you're objective and rational and scientific in your analysis, it's very clear that by and large, East Asian societies like China, like South Korea, like Singapore, have done relatively well at managing this COVID-19, relatively speaking, but it has to do about the fact that East Asian societies believe basically in what Nobel laureate Amartya Sen said, that for societies to succeed, you need the invisible hand of free markets and the visible hand of good governance. Unfortunately, in the West, and especially I would say in the United States, they used to listen to President Ronald Reagan, who used to say, government is not the solution, government is the problem. So as a result of that, there has been a progressive defunding, delegitimization, and of course consequentially demoralization of the public service agencies in the United States and to some extent in the other Western countries. And so I think that was a mistake that they made. And so the time has come perhaps for the West to try in some ways learn some lessons from East Asia and realize that for societies to succeed, you have to strengthen institutions of government as well as the private sector if a society is going to succeed.
You're watching World Insight, still to come on our program. There's nothing like the universal language of music to bring together people from around the world. One renowned pianist from China is doing his part in this effort. That interview with Lang Lang right after this break. Welcome back. You're watching World Insight. I'm Tian Wei. As the coronavirus further spreads around the world, artists from the world are set to come together for a globally televised special in support of efforts to contain the coronavirus pandemic. One World Together at Home aims to support frontline healthcare workers and the WHO. It brings together artists and pop stars doing what they do best, including Lady Gaga, Andrea Bocelli, and Lang Lang. Earlier, I spoke to the Chinese pianist Lang Lang. The world-renowned artist tells me in this exclusive interview about his quarantine days at home and why he's determined to support this global campaign, One World Together at Home. Lang Lang, wonderful to see you. Let me ask you about that concert, One World at Home. Are you looking forward to it?
I'm actually very excited about the concert live from home. Also, all of the musicians will play in the kind of independently,
Right.
and then to put everyone together. So it's a very unique experience.
Absolutely, we're looking forward to that moment. I mean, what is the one that you're chosen?
I'm actually playing a song called Prayer, and I'm actually playing with some of my absolute favorite musicians like Bocelli, Lady Gaga, John Legend, and Celine Dion. And I must say, they did an amazing arrangement for this song. The piano almost kind of like a orchestra. Our beautiful melodies to share to each other. So it's almost like a chamber music feel, and it's really good that this is a really, the song is kind of like a staying at home, sharing our love.
This has been regarded as the live aid for COVID-19 in a way. We all remember that historical concert taking place decades ago, but this time for our generation, this is unique. Of course, we're excited about it, but this is also a time that's sad because the pandemic is taking away lives. For artists like you, how would you balance among all of these very different emotions?
I know that in 1985, that was a very, very most incredible concert. It's almost the same idea as 35 years ago, but the display is a quite different one.
It's going to be challenging, but at the same time exhilarating, isn't it? I wonder, when you are playing your piece at home, who are going to be on your side? Your parents, your wife? Are they going to be your first-hand audience? Are you going to be nervous because they're so close to you?
my wife was the camera lady at the time. So yeah, so because that time I was actually on quarantine at home,
right?
And my mom also helped a little bit of lighting, something, so gave me some water to drink. So it was a real family production in a way that.
It's a teamwork and certainly a product of family reunion, right, during quarantine days.
Yes.
Quite challenging days, not being able to walk around. What's your feeling about quarantine?
Yeah, stay inside, and this is something I think it was a little bit hard because I sometimes like to go out to get some fresh air, and that was maybe that was kind of not so easy to do. But other than that, I mean, there are a lot of things we can do at home. Actually, we can practice. I practice a lot, and I learn many new repertoire. And of course, having family dinners and lunches with my wife and with my mom. Also, I would say we made a lot of videos to encouraging people, with piano music, with some of personal speech, to cheer people up.
Exactly.
Yeah, so I think we can still do a lot of things.
You're now not only teaching kids about music, as you mentioned earlier in your videos, but rather you started a foundation. It's the Lang Lang International Music Foundation. You also try to do this music projects around the world, providing kids with pianos to play with and also to provide them with real music education. How does that work? And how is that, part of you related to everything now you are doing right now, including with this concert?
First of all, I believe music is so powerful, as we talked about before. And so after being a UNICEF ambassador in 2004, I founded my foundation, the Lang Lang Music Foundation, in 2008. And our aim is to nurturing the next generation of wonderful musicians around the globe, and also to build up a new music program in the public schools, because very often around the globe, the public schools doesn't have a music class due to budgeting problem or other problems. So what we did first is to creating the programs which also involve with technology, because we can now work with 30 kids in a music class in the same time with one teacher. Music, for me, if you don't really play yourself, it will be very hard. It's like learning a language. If a language you only learn but never use it, never communicate with it, then you will never improve. And so I think the communication is the key with music as well. It was exactly the same as in socializing or like communication, building a bridge.
Right. And also playing from home is also important, as you are likely to demonstrate during that concert.
Yes, I mean, this concert is so important. I think this concert is a real something that I think people need at this time.
Right.
It's really, really, I mean, I think as a human being, we need music. We need great, kind of emotion being together. And this is a concert that I think people are waiting for.
You're a genius, Lang Lang. Everybody knows that fact. But, in your age now, in your 30s, what do you think about your stage today? And how are you looking at your future in a way?
As age growing older, but this, kind of growing more mature. I mean, it's important. I think that we should keep exciting and fresh feelings out from our heart as kind of a first thought, not as a second thought, first thought. But in the same time, we have to develop a sort of mission in life, not just being, a concert pianist for ourselves, but also to become someone who can support other people, who's more helpful in other people's lives.
Right.
So recently, I started to play more Bach, and I just recorded the Goldberg Variation by Bach.
Why? Why Bach?
First of all, the Goldberg Variation has always been a great dream for me to achieve, because for me this is the most incredible piece to learn. It's a real life piece to be in with it. And also, I think this is also, talking about when you grow up older, you have to take more mature challenges, not just using your technique to impress people, but to work with your knowledge to, move people.
Yeah, and you did that, I'm sure. And we are looking forward
I hope.
to your performance during the work from home concert. I'm sure it's going to be a very different Lang. Before we go, I mean, you are a guy who traveled around the world every year, 70, 80 concerts every year. But now, COVID-19, people stay at home, at least stay in their own cities. What does that mean to you as a musician? And does it mean you also have to adjust your lifestyles? This is paramount.
It's very difficult. I mean, I basically postponed all my concerts until until September. So the entire spring is off and the entire summer is off. So obviously, for any musician or for someone who has to play in the theaters somewhere, it's a real difficult time. Very difficult time. In the same time, we are lucky because we're still, healthy.
Yes.
And so we should be really appreciative of that, and we should just be patient and wait when the time is right, and to start playing again.
All right, Lang, thank you so much. Really appreciate time. I know you have an extremely busy schedule right now. Thank you so much. All the best to you and your family.
Thank you.
And that will do it for this edition of World Insight. To find out more, you can always search us, World Insight CGTN, or check out our YouTube channel. Follow us on Twitter and Facebook. I'm Tian Wei. On behalf of the team, thanks for watching. Bye, friends.